Suicide is the second leading cause of death among teens and young adults ages 10 to 34, according to the CDC. It is National Suicide Prevention Week, and we do want to welcome, joining us now, Dr. Linda Lang of VHC Health with information about how to spot someone at risk of self-harm and local resources as well. Dr. Lang, thank you so much for joining us. Let's start with the numbers. What do they show in our area?
Well, actually, there's been a lot of attention over the last couple of years on teenagers and suicide. So we are seeing some improvement overall in the number of suicide deaths. There were approximately 35 suicide deaths in our county most recently reported. But there is hope. The numbers have gone down.
So that is some good news, but we know nationally this is a challenge. How do you approach this topic? I mentioned the ages. I can't believe as young as 10. Where do you begin the conversation? What's age appropriate?
It's a great question. 42% of our teens are struggling with depression and anxiety. It is important to have the conversation, ask the question. We don't plant the idea of suicide by asking the question. If we're noticing that there's a change in behavior, isolation, not going to school or wanting to do things that normally our teens love, ask them, are you feeling suicidal? Are you struggling with thoughts of not wanting to live? And be non-judgmental, open up the conversation and listen.
And what are some of the warning signs?
The warning signs are certainly decline in grades, sudden changes in socialization, not wanting to see friends, not wanting to go to school, staying up late at night in their room, not joining in on family events, and not being themselves, really a change. And I know that can be tough sometimes with teenagers, but we usually do see something pretty different than what's normal for us.
And how can we help someone who may be contemplating self-harm?
Well, I recently talked to a mom who was afraid to talk to her daughter and ask the question. And her daughter happened to be spending a lot of time in her room, not coming out, not doing her artwork and things that she loved. So Mom asked me what she should do. I said, have an open conversation, which she did. And it turned out her daughter had been talking to chatbots and getting not very safe advice. So we were able to, Mom went home and asked her daughter what was happening. She said she was feeling suicidal. She thought that she was a burden to the family, and we were able to get her into help. She's now a thriving college student. So we can ask the question and then listen really well, ask the question open-ended, and seek help. Keep our kids safe until we can get them to help.
And that is so important because ultimately that's what we want to do, save lives. What are some of the local resources, finally?
Well, 988 certainly is available to anyone. It is our national suicide and crisis lifeline. Anyone can call and receive help. Here at VHC, we have an adolescent program. It's an intensive outpatient program that we run after school, where kids can learn how to develop resilience and have a toolbox on how to cope with anxiety and depression and feelings of worthlessness, and how to talk about it freely with other peers.
Such an important reminder to check in with our loved ones. Thank you so much, Dr. Lang, for joining us today to raise awareness.
Thank you for shining the light on this topic.
Absolutely.